The National Health Insurance Bill is being sold as the answer to South Africa's healthcare crisis, but is it really about fixing the system, or just creating a new cash cow for corruption? Today on SA Unfiltered, we dive into what the NHI really means for doctors, patients, and every South African who's already fighting to survive in a broken system. You want the truth? You're in the right place. South Africa's government says the National Health Insurance Bill is the beginning of health equality. But millions of citizens, from doctors to patients to civil society groups, are asking a simple question: who exactly is this bill supposed to help, and at what cost? The NHI is being sold as a solution to a broken public health system, but for many, it feels more like a political weapon than a policy of care. And in true South African fashion, the people at the center of it, the nurses, the rural clinics, the working poor, have been left out of the conversation entirely. Let's be clear, the idea of universal healthcare is not the problem. In a country scarred by apartheid's deep inequality, access to quality health services for all South Africans is not just a dream, it's a necessity. But dreams without planning become nightmares. And that's exactly what the current version of the NHI risks becoming. A centralized fund controlled by government. Billions of rands in contracts. And absolutely no clarity on how it will be paid for, protected from corruption, or rolled out without collapsing what's left of our already strained system. Right now, the public sector is in crisis. Hospitals are understaffed, emergency rooms overcrowded, equipment outdated, and medicine stockouts are routine. Nurses are overworked, ambulance services are stretched thin, and infrastructure is decaying by the day. And that's before we even touch on the chronic mismanagement and corruption that has robbed billions from health budgets. This is the system that will now be responsible for every South African. That's not reform, that's roulette with people's lives. Meanwhile, the private sector, though accessible to only a small portion of the population, carries the bulk of specialist care, advanced diagnostics, and critical interventions. It has its own problems, yes, including inflated costs and profit-driven motives, but it works. It's efficient. It's modern. And instead of fixing the public sector to match it, government now wants to absorb and control both. That's not equity, that's empire building. Health professionals are raising red flags across the board. Many are considering leaving the country entirely. Others are already preparing for court challenges. Why? Because the NHI offers no real transparency on how funds will be safeguarded from looting. It gives a politically appointed board sweeping powers with little oversight. And it risks turning our healthcare system into yet another feeding trough for tenderpreneurs, cadres, and connected elites. We've seen this movie before, and it doesn't end well. Let's not forget, South Africans are already taxed to the bone. Load shedding, failing municipalities, pothole-ridden roads, crime, unemployment, and now the same state that can't fix any of those is asking the public to trust it with their health too. To pour billions more into a fund with no guarantee of delivery, no plan for rollout, and no protection from the same corruption that broke Eskom and SAA. It's not cynicism. It's common sense. Even worse, there's been no real consultation with the people who'll be most affected, the working-class South African who queues at 5 a.m. outside a broken clinic, the pensioner on chronic meds, the nurse who hasn't seen a pay increase in years, the young doctor drowning in a collapsing system. Instead, the message from the top has been simple: take it or leave it. But when public trust is already hanging by a thread, that kind of arrogance only fuels resistance. The NHI, as it stands, is not a policy designed to heal, it's a policy designed to control. To centralize procurement. To strip medical schemes of their function. To override provincial systems. And to create a fund so massive, so powerful, and so unaccountable, that the potential for abuse is staggering. And the timing? Conveniently just in time for an election campaign that's running on fumes and legacy slogans. But the truth is, South Africans aren't against change. They're against being lied to. They want healthcare that works, not just for the rich, not just for the connected, but for everyone. They want clinics that are safe, hospitals that are clean, ambulances that arrive, and nurses who are supported, not drained. And they want a government that listens, not lectures. That builds systems, not slogans. Right now, the NHI feels less like progress and more like politics dressed in a lab coat. If we're going to talk about healthcare justice, we need to talk about real solutions. Strengthening provincial systems. Proper training and retention of health workers. Ring-fencing health budgets from corruption. Ending ghost staff. Fixing procurement. Introducing digital records. And most importantly, creating a system where transparency is the default, not the exception. Because health isn't just a department. It's dignity. And no South African, black, white, rich, poor, should have to beg for it. But dignity doesn't come from bold promises. It comes from delivery. The kind you can feel, not the kind you read in a press release. This is Essay Unfiltered, where we ask the questions they avoid, and say what needs to be said. If you're tired of politics dressed as policy, if you care about real reform, and if you believe health is a right, not a reward, hit that subscribe button now. Because we're not here to whisper. We are here to expose. Loudly. And unapologetically.